Hello, thank you for joining us. You are watching On the Move with Lady Kate. I have two amazing women, frontline heroes this evening, and we are going to be talking about the vaccine, COVID vaccine, and how it saves lives. So, very, very important conversation for our community because even though the United States is really, really aggressively distributing the vaccines and people are signing up, there is a lot of hesitancy from from the immigrant community, the Black community, the minority community. People are not really taking up and signing up for the vaccines as expected. So it's really important that we have these conversations and help to alleviate the fears that people have about the COVID vaccine, because we know from history that vaccines do save lives. So it's such an honor to have two of our great Cameroonian women who are frontline heroes. Let me bring on Dr. Brownhilda Santo. Just 1 second. Okay. Okay, there you go, Doctor. How are you?
Good.
Good.
Thank you for having me on today.
Please introduce yourself. Tell us the great things you've been doing on the front lines.
Well, my name is Brownhilda Santo. I am an internist, a pulmonologist, that's a lung specialist, as well as a critical care physician. And I have been taking care of COVID patients at all levels of severity, from those who have had just mild symptoms to those who've had severe symptoms, and critically ill patients, as well as, unfortunately, not able to save. I haven't been able to save everybody. So my goal today is to kind of enlighten and continue to provide education, which I have been doing for the past few months, about how we can prevent this disease.
Wow, thank you. We are excited to hear all the knowledge that you're going to be sharing. Next, let me bring on our great pharmacist, Gwendoline Tucker Egbe. Please introduce yourself. Thank you.
Hello, good evening. Thank you for having me, Lady Kate. I am Gwendoline Egbe. I've been a pharmacist for over 20 years. And my goal here today is to just teach people how to get their vaccines. I've been rolling out vaccines since it was introduced in the United States. We've given a lot of shots to a lot of people. So I'm here to try to help people understand how safe they are and why we are where we are. Thank you.
Wow, thank you so much. That's amazing. I'm going to go to Dr. Santo. You've been working so hard. We've seen you dressed up in those PPEs and on the front line all the time. Now there is hope. The vaccines really offer hope, the COVID vaccine. And we have three that have been approved in the US and people are signing up. You've seen the devastation because you're working with these patients all the time. I want you to just explain how vaccines work and, just help to alleviate some of the fears that people have about the COVID vaccine.
Okay, so I would say vaccines are our best defense against this disease. And vaccines have been around since the 18th century, when smallpox vaccine was discovered by Edward Jenner. And it has helped in increasing the life expectancy. In fact, some of the epidemics or outbreaks of pandemics in the past have been controlled or eradicated thanks to vaccine. An example is smallpox. Measles has also significantly decreased in incidence and prevalence as a result of vaccines. In fact, in the 1980s, we had about 2.6 million people who died globally. And this has decreased, and data from 2015 is down to the 130s, and I'm sure it's even better. Polio has also decreased significantly, almost eradicated, but for countries like Afghanistan and Pakistan, because of the war there and the vaccination against polio hasn't been as great. So the COVID-19 disease, which is caused by the SARS-CoV-2 virus, will also need this vaccine. Now, let me explain how vaccines work. Pretty much, the vaccine is there to prime our immune system, help it develop a particular line of the immune system, which is the adaptive immune system, shorten the time for that adaptive immune system to develop, and also induce a memory of the immune cells to have a memory of this particular pathogen, in this case, the virus. So when we take the vaccine, our bodies have two major lines of defense. I will be very basic. I'll try to really break down things.
Yeah.
We have the innate immune system, which is the first line of defense, which will come in, pick up the vaccine, and then present it now to the adaptive immune system, which is the more robust immune system that we have. The adaptive immune system also has two arms, and pretty much there will be several processes which will lead to the development of two particular important cells called B cells and T cells. The B cells will go on to produce antibodies, and some of these B cells will then become dormant, so they will become memory B cells. The T cells will also produce cytotoxic T cells and T helper cells. These T cells will also go dormant. Some of it will differentiate to become memory T cells. So now, normally, this adaptive immune system takes about 7 to 14 days to build up and fully develop. But when you have this memory B and memory T cells present, they will be able to kick in within a short period of time. So let's say you take the vaccine, and now you're exposed to the actual virus itself. The adaptive immune system, the innate will kick in within 24 hours. It's always there, the first line. And then the adaptive will take now about just a couple of days to kick in. And that memory B cells and memory T cells will easily recognize this pathogen, in this case, the virus, and produce specific antibodies and specific cytotoxic T cells against this virus. And so the response will be robust within a short period of time. You will have two lines of defense that kicked in within 48 hours or a few days. And this will prevent the virus from infecting the cells, and hence decreasing the viral load, because you won't have enough, they won't have enough chance to even infect the cells. And even if they do infect the cells, the body is going to eliminate it using its cytotoxic T cells and other immune cells. And so you may just have a mild infection. And you know, it's better to have a mild infection than having a severe infection or even dying. Mm-hmm. And as time goes on, I'll talk a little bit more. But the vaccine is important because it is going to prime your immune system, make it develop memory B and T cells. And then when you get exposed to the virus itself, trigger those immune systems to respond quicker than usual.
Mm-hmm. Wow. That is amazing. Thank you for that explanation. I never, understood basically how vaccines work. So you explaining that kind of, it really helps. And I'm sure I'm not alone. I joined the line and I go take my vaccine, but, really understanding how it works, that really, really does help. Now, Gwen, you've been on the front lines, working so hard. I've seen sometimes when, you've been so stressed and your face, with the mask and all the PPEs, how much damage that can cause, especially when things were really, really, really bad. We do have some hope now. There is hope with the vaccines, but you've been there. Tell us about some of that experience.
So basically, it's been a struggle, just like everybody else. It's been a very, very unprecedented year, but we're still here, so we thank God.
Yeah.
It's been rough because just like most of the healthcare workers, we all walked through it. So we had to wear all the masks and everything when it was like spreading, especially when we didn't know much about it, and the fright, and you just going to work was just so stressful. And like Lady Kate said, I was just breaking out because I was trying to wear those N95s. And it just depends on which one you're using. And sometimes it doesn't work well with your skin. I think I found another one which is better now, but I've gone through a lot of it. But vaccines are here. This help is here. And since the vaccines came, I'm in charge of rolling out the vaccines at my practice. I'm the pharmacy manager at my practice. So we started with the long-term care facilities, and we're going there, running those clinics, trying to get those people who are inbound and the elderly. And since then, I think as a company, we're done with the long-term care. And the Biden administration rolled out the retail pharmacy program. So now I actually run the vaccine clinic at my store alongside filling those prescriptions. So it's still very stressful, but we're happy it's here. And I can say that people should not be scared. I've had mine. I'm sure Dr. Santo has had hers. Lady Kate has the
I
first dose.
did, yes.
Yes, we both had our vaccines. We're still here. And I just wanted to put it, a lot of people are scared of the vaccine. We used to vaccines in our community. We grew up with it. But I think it's because of the speed in which these vaccines were approved. And I just wanted to shed some light on it. So the vaccines were approved really fast. It doesn't mean that they're not effective and safe. The reason we're here today, or it came this fast, is because of the Operation Warp Speed. What that was, the federal government partnered with these vaccine companies. So basically, they were running the clinical trials side by side. Usually, they would do one like phase one, finish, then go to phase two, then phase three before they even start production. But because of the way this COVID was just killing people in this country, the federal government stepped in. So a lot of those bureaucracy, it's like a lot of things were done at the same time. So they were running different arms of the trial concurrently, which is why we're here today. Even the manufacturers were already producing the vaccines while they were still running clinical trials. So by the time it was approved, they were ready to go, which is why you see like, okay, FDA approves today. The next day we saw all those trucks around the country trying to distribute the vaccines. So they're here, they're safe, no corners were cut. It was just an emergency, and they had to do it in a very, very, very fast way as possible.
Wow, I'm so glad you kind of highlighted that, because again, that's what a lot of people talk about when they express their fears, that it was done so fast. And then we also have those who think it's some kind of numbering system with the beast, and we are part of numbers. That conspiracy is what I don't understand, because as a community, even back home, we are used to vaccines. Vaccines have eradicated pandemics, they have eradicated deadly diseases in the human race. So I'm glad, Gwen, that you touched on that point. So back to Dr. Santo. Having explained to us how vaccines work, how else can you encourage our community to dispel this myth and hesitancy that they have?
Okay, so Gwen actually made some really good points about about why the vaccines came out this fast, which is, I think, one of the major concerns that I've gotten from a lot of people, not just in our community. I would like to shine some more light on that. The technology, what people do not know is that the mRNA technology, because a lot of people are concerned about this mRNA virus, that is some foreign particle, something that's been laced with, I don't know, to spy them. 5G technology, something like that. The mRNA technology has been around for decades. And there have been preclinical trials on other viruses flu virus, Zika virus, cytomegalovirus, rabies virus. They actually have been preclinical trials, so clinical trials done in test tubes in culture on using this mRNA technology. Also, the reason we call the virus that causes COVID-19 SARS-CoV-2 is because there was actually an original, well, not original, but there was another SARS-CoV in 2002, which happened in Asia as well. And there was also a MERS, Middle Eastern Respiratory Syndrome virus, which is a coronavirus also. It happened in Middle East in 2012. So the first one, the SARS-CoV 2002, has actually 80% similarity to SARS-CoV-2, hence the name SARS-CoV-2. The MERS has 50% similarity to SARS-CoV-2. Why am I saying this? Scientists have already been working on those other viruses, trying to see which, how they can produce vaccines in case we have a similar problem. And so they already knew about the spike protein, which is what most of the vaccines target. Most of these vaccines for COVID target. So by this time, when COVID-2 came, when SARS-CoV-2 causing COVID virus vaccine disease came, they already knew what to target because of that similarity. There was a background, and the scientists collaborated a lot. And like Gwen already said, the phases were done different phases were done at the same time. So others were not, they already knew about the mRNA technology. They already had some work on it. They already knew about other types of coronavirus that were very similar to this, and had been working on those. And also the mRNA technology is easy to use to develop and produce massive number of vaccines. For instance, if you have what we call the traditional vaccines, where they used whole viruses and had to inactivate them, so kill them, or they had to attenuate them or weaken them, you had to that was a painstaking process. And it sometimes may take a very long time to produce. So with the mRNA technology, we don't have that. So it's very easy to produce in mass. And so this is just to add to what Gwen mentioned, that these are all reasons why the vaccine came out this fast. And so people should, and they are very highly effective. Efficacy of 95% for the Pfizer, 94% for Moderna. Johnson & Johnson has 66%. But people should not only focus on the efficacy. When they say efficacy, that's the overall efficacy is to decrease infection. So for instance, if I take the Pfizer vaccine and I come in contact with the virus, I have a 95% chance that I will not contract the infection. However, all of these vaccines had very high efficacy in preventing severe disease, hospitalization, and even death. So our goal here also should be taking a vaccine that will help prevent you from developing severe disease, because most people have had cold. The goal is for you not to be hospitalized to the point where you have severe disease or even die. So any of these vaccines are very, very effective. Now, people think that, well, the Johnson & Johnson is low. Let me give you an example. Flu vaccine. The flu vaccine has an efficacy of probably 40 to 60% sometimes. If you're really, really, mostly in the 60s, hardly even 70%. So most of the time in the 50s. But we all take the vaccine. We don't, at least when it's offered, we don't really complain a whole lot. And we don't even look at that efficacy. So all the vaccines that are currently available are actually more effective than the flu vaccine.
Wow. That's amazing. Thank you for that knowledge there. And so regarding the hesitancy that our community is facing, Gwen, how do you think we can alleviate these fears that people have?
I think like what you're doing is very good. This is just like one of the best ways to alleviate it, to talk to them, come to the community, and like we're explaining, because it's just knowledge is power. So a lot of people are scared because they don't know what's going on. Like Dr. Santo said, has explained how the vaccine works in your system. When they understand that, I think they're going to be able to be like, oh, okay, so if I don't get the vaccine, then by the time my immune system comes in, I'll probably be very severely sick or maybe even dead. So maybe I should take it so that I can stop it before it gets to that stage. And also with the vaccines that they're coming up with right now, the Johnson & Johnson vaccine, I was going to add to that. Like I've had people ask me, which one is better? Just like what Brownhilda was saying. Therefore, the one that is better is the one that is available to you right now. So because the mRNA vaccines, they are like in the 94% efficacy, like you said, but the end point and the most important thing is even the Johnson and Johnson, it was like nobody ended up in the hospital and nobody died from it. And also the Johnson and Johnson, it was being studied in like South Africa and Brazil when the new variants were coming out. I'm going to touch on the variants and why we should really get this vaccine so that the variants, we can stop them from coming. So because of that, that's why the efficacy of the Johnson and Johnson is lower, because their studies were done around later in the disease when it was widespread, more people were sick, and most of the variants were already out as compared to Moderna and the Pfizer vaccine. So we don't know if the Moderna or the Pfizer vaccine, if they were studied around the same time and in those regions where the variants were already out, how efficient it would have been. So I'm thinking, so people should understand that there's a lot of factors. So Johnson and Johnson is just as good because, like Brownhilda said, if you get COVID and you don't end up in the hospital and you don't die from it, I think that's basically what we're looking for. Because then it's like the common cold, which we all go through it and we're not worried about it. We're not scared about it. We hang out with our loved ones. So that is the goal here. So whichever vaccine you come across, you should take it. Also, for those who don't want, a lot of people are busy and stuff, Johnson & Johnson has that advantage. It's just one dose. So you take one dose and you're done, as opposed to the 2 doses. I had somebody come today for their second dose, but they were exposed to somebody that had COVID about 3 days ago. So guess what? I wasn't taking them into my clinic because they've been exposed. So that just means that they were not able to get their second dose yet. They have to wait 2 weeks before they can come back. But with the Johnson & Johnson, we're not going to have that problem because once you get one dose, then you're done and you're good to go.
Wow, great information there. Awesome information. So we get people asking these questions, and thanks, Gwen, for addressing that. People do ask, what if I've had COVID? Am I immune to COVID-19 now, so don't need the vaccine? I know a few people who have had the COVID and it's, oh no, I'm immune now. Dr. Santo, can you address that?
Yes, so far the recommendation now is to take it. Why? Because there had been some studies which show that even though those who've had the vaccine, the disease, had antibodies, the antibodies titers actually were not as great as when they gave them the vaccine. In fact, even just after one shot, they developed a more robust immune response and had more antibodies. So they actually, their protection increased significantly. So for now, it is advised to go ahead and take the vaccine for that reason. Now, we also still do not know exactly how long the antibodies will be around, although we're actually fixated on antibodies. But remember, I mentioned that there are 2 immune system cells. You have those cytotoxic T cells, which are playing a big role, if not even more important role, because with SARS-CoV, the original SARS-CoV, that was 80%, that's 80% similar to this current SARS-CoV-2. They found that the antibodies in those who had the disease lasted for about 2 years, and about 17 to 19 years down the road, they found that their cytotoxic T cells were still pretty available to protect those patients. So only time will tell. But for now, it is recommended that even if you get the infection, you should go ahead and also get the vaccine.
Wow, that's awesome. Thank you for explaining that. So, Gwen, you being a vaccine pharmacist who is right there at the front lines in distribution, I have a little issue, like, just advise how people can sign up for the vaccine, because you can't just walk to a CVS or any pharmacy and say, hey, I'm ready, right? There is a system that is established to help people sign up and register, right?
Yes, so basically you have to have an appointment. It's been a mess. I agree with that. Because a lot of people are fighting to get this appointment. It's very, very hard to get an appointment. But one of the ways nationally, if you're looking for a shot, you can go to findashot.org,
Mm-hmm.
findashot.org.
Mm-hmm.
And it will put you, like, you put your zip code or your state, and then it will tell you where you can actually sign up to get a shot. In Maryland, I'm in Maryland, so I have more information about Maryland. We go to
Mm-hmm.
covidlink.maryland.gov and you can sign up. The governor is actually rolling out a lot of these mass clinic sites, and you can pre-register for those clinic sites, those mass vaccination sites. So it's covidlink.maryland.gov, and nationally is findashot.org. So that's,
Okay.
or you can, for my company, you just go to walgreens.com/vaccine and
Yeah.
you'll be able to get an appointment. They're not easy to get. A lot of people, but people are getting it every day. And I keep asking them, like, how did you get an appointment? Because people are calling me every day. They just have to keep refreshing. They just have to, this, like, people stay up. Everybody, a lot of people out there trying to get this vaccine. So the system is overloaded, but it does work. It's really slow, but it does work because I'm giving vaccines to people who have appointments every day.
Wow, that's amazing. Thank you for sharing that information. I also do work in DC as a healthcare worker. So the DC mayor is constantly updating. We're getting updates about vaccine availability. So, on the DC mayor's website, it's also on there. So there's lots of information on how to get registered. You have to do like pre-registration, and then your appointment will follow. So that's good. As we round up, this has been very, very a very powerful information that we've been sharing here, and I think it's going to really empower our community. So, Dr. Santo, one last take on this, encouraging people to go out and register and get their vaccines.
Okay, so just to add also, people can go to a vaccine finder online, and I think different states have do things differently. You can go to the health department in your state, and you have information on that. In West Virginia, it's pretty easy actually. My daughters also have gotten it, so. And they didn't have to initially when it started. I had to go and sign it. They just went there and filled some paperwork, and they got it. So each state is different. I would encourage more people to take this vaccine, because in order for us to control this pandemic, we need to reach what is we call herd immunity, and that is a particular threshold of a percentage of people that have to be vaccinated to control a disease, and it depends on how contagious that disease is. And initially, they were calculating this at 50 to 70%. Now, even to 70 to even 85%. And so you can imagine how many people need to be vaccinated for us to reach herd immunity in the US. And vaccination saves lives. Sometimes we may think we're strong, we're young, but sometimes you vaccinate too for the community, not just for you. It's a public health crisis. There are some people who cannot take the vaccine for one reason or the other. And if enough people are vaccinated, you're actually going to protect those frail people who cannot take the vaccine as well. So I have worked with really sick patients. I've seen patients die in my hands. I've seen the devastation of COVID. The vaccine, people say, it has a lot of side effects. Actually, some of the effects that you feel, I call them expected effects. For instance, the sore arm, the fever, that's your immune system actually working for you. And just like any substance or medication, there are always side effects. You always have to weigh the risk and the benefits. And aspirin has side effects. Acetaminophen has side effects. So there's really no medication without side effects. Our community is hit hard. And we have the vulnerable people also. I think maybe we forgot to talk about this. Those who have multiple comorbidities, the people are more at risk. Your diabetic patients, high blood pressure patients, coronary artery disease and heart disease, kidney disease, patients with chronic lung diseases, elderly patients who are immunocompromised. They have either because they're taking medications for their, that causes them for their immune system to be weak, or because they have some disease that's causing their immune system to be weak. So we have to really look at this not only from the perspective that we're looking at ourselves, we're also looking out for the community. So I will invite my community, especially. There's a lot of complacency. There's a lot of conspiracy going around. My community doesn't even believe that. And right now in Africa, in Cameroon, I've been communicating with physicians in Cameroon. It's really, really bad. They're having up to 7,000 cases sometimes a day now. And unfortunately, they don't have the resources. Oxygen, because it's even a luxury. So people are dying because of lack of oxygen. So if we don't take this disease seriously, a lot of people will die when this could have been easily preventable. So I will call on everybody to just rethink and do the right thing for themselves and for the community.
Wow. Thank you so much for explaining that as well. Talking about Africa, Cameroon, that's another whole conversation, right? Because we know that right now there is a surge sweeping through Africa, and we're getting a lot of deaths and people falling sick, and like you said, limited resources as well is a big challenge. But just looking at some of the comments, I want to acknowledge Dora, our good friend, Dr. Dora Tambe, sharing that this is very, very powerful information. Thank you very much. Glad you found it, very informative. And also we have a comment from Johnny Elangwe. He says, how is Johnson & Johnson, is a question. How is Johnson & Johnson better than the others? I'm not interested in its single shot medically, I mean. So who wants to take that?
I can take it.
Okay, Gwen.
Like I said before, there's no one vaccine that is better than the other one. But Johnson & Johnson uses the adenovirus mechanism, which is like it uses the DNA, which a lot of people are not worried about, because a lot of hesitancy when they say that they've put a chip in your arm, they're talking about the mRNA that is inserted into your system. But because the Johnson & Johnson uses the DNA mechanism, it's just some people are just more comfortable because they're scared that the mRNA will be replicating into your system. And I just wanted to add that it really doesn't replicate in your system. Once the mRNA gets into your system, the ribosomes translates amino acids, which goes ahead and forms the spike protein. Then the mRNA from the vaccine is actually destroyed. So it doesn't stay in your system and replicate. So for those who are scared of that replication, I think their option would be the Johnson & Johnson. That's the way I look at it. And just to wrap up on that, I also wanted to add that we have to take this vaccine seriously, because that's the only way we're going to stop the spread and the variants. The variants that are coming out right now. It's very scary because all the work that has been put in can really be just erased by all these variants. So how does that happen? Once we stop the spread, variants occur when the virus replicates, like it just changes forms when it goes from one person to another. It has to get into your system for it to replicate. So if you take your vaccine, then we stop it from replicating, then the new form or the variants, like they call it, will not be formed. And eventually our vaccines that have been formed will give us the herd immunity that we have to have so that we can get back to normal. So, and also I know in our community, we have a lot of healthcare professionals. We're all healthcare professionals. I just want to end by saying that the end point of these vaccines it's not really for you not to get the disease and transfer it to somebody else. The end point was that you should not get sick and end up in the hospital or eventually die from it. So those of us who are healthcare professionals who are fully vaccinated, we should bear in mind that that's why we still have to take the precautions, still wear a mask, because the herd immunity, like Dr. Santos said, we're going to go to about 70 to 80% of people vaccinated before we can get there. So we have a lot of people in our community. We have a lot of people around us. We have our most prized possession, our children at home. A lot of them are not vaccinated because of their ages. So even though we're fully vaccinated, we still have to wear this mask and social distance and just prevent it, because I can carry the virus. I might not get sick, but I might actually have it in me and bring it home to somebody who might get sick from it. So that's just the way I want to end this conversation tonight, that we should be mindful of the fact that even if we are fully vaccinated, we still have to take precautions, because it's going to be a long haul before we get to that herd immunity.
And I have good news also to add. The Pfizer vaccine, they did some analysis, and actually recently, this was a few days ago when this was in the news media. The vaccine is effective also, or they found efficacy in children between 12 and 17 years. And they're going to also apply for I think they're in the process of trying to apply for the emergency use authorization. Also, both the Pfizer and Moderna vaccine recently, there were some studies done also, and it was found that it seems like it also prevents transmission, which was the question that people had before. So, that if you take the vaccine, can you still transmit the virus to somebody if you contract or if you come in contact with the virus. So it seems as if it helps to decrease transmission too. So that's a very good news.
Okay, very, very good. Let's also look at other comments. We're getting a lot of comments, and kudos to you for the information that's being shared. We also have a comment from Ms. Pamela Egbe Messi. Saying, thanks, ladies. What can you tell the people of our communities and abroad, Blacks or Africans, well-educated, who still believe the vaccine is just to put chips in us? This is serious, and you have to explain. She's begging for an explanation. I think we kind of touched on that. Gwen did, and Dr. Santo also did. But you want to just answer her question real quick, Gwen?
So basically, I think what I said was, when people are talking about the chip, it's because of the mRNA that is inserted, and because it does replicate in our system. I think that that's what people are talking about. But really, when this mRNA gets into your system, the ribosomes translates to amino acids that actually forms the spike proteins. After the spike protein is formed, the mRNA or the chip, whatever they call it, is actually destroyed by your cell. So it doesn't really stay in your system forever, like a lot of people are saying that I don't want mRNA in my system to be replicating. And that's where the educated ones come, because they understand how it works, that it does replicate in your system. It really doesn't stay there. Once the spike protein is formed, it gets destroyed by the cells and it gets out of your system.
So, Lady, can I say something? I think I understand where this confusion is coming from. Yes, the name mRNA, people are not familiar with it. What is really mRNA? That's a messenger ribonucleic acid. And what this does is pretty much it carries information, genetic information. So the spike protein's genetic information is copied using the mRNA. And that mRNA is now used, the lipid nanoparticle is used now to use that mRNA that has carried that genetic information from the spike protein into the cell. Actually, what people do not understand is that even though the adenovirus, which is used as a vector in the Johnson & Johnson, the same spike protein mRNA is the genetic information is used, but it is converted into a DNA because the adenovirus has a DNA and then combined. So both of these vaccines are actually, they belong to a particular group called nucleic acids. So they are subunits. Sometimes what we are used to is the original, what you call the traditional vaccines, which are whole vaccines. They take a whole piece of vaccines, but they are all sort of virus and use it to make a vaccine. Either they weaken it, attenuate it, or they kill it, inactivate it. But there are also subunit vaccines, and these subunits, the mRNA, the subunit just means you're taking part of the virus. In this case, a spike protein. And with this new technology, you're using the nuclear code, the genetic information. With the Moderna and Pfizer, they use the genetic information and use that messenger RNA to take it now and use it to send the message into the cells to produce that spike protein, which Gwen has already really explained, so I don't want to go into that. But the adenovirus actually still uses the same genetic information, but they take that mRNA, that genetic information, they transfer it into a DNA and then combine it with the DNA of the adenovirus. So people do not know that this is actually almost the same information that you're getting. So one is being transported through the messenger RNA and the other one is being transported through the adenovirus. Why do they even use this? Because our cell membranes are made up of lipid particles. They are very selective. So the adenovirus has been used to, adenovirus gives us cold. So our body, they know how to get into our body. So they did use the adenovirus, got that genetic information from the spike protein and transported it into the cell. Meanwhile, the Pfizer and Moderna, they used the mRNA. Because the mRNA is very fragile and cannot enter the cells, they had to use the lipid nanoparticles, which are just lipid droplets, and then got that into the cell, and then the rest of the processes that Gwen mentioned. So these are almost the same, using the same genetic information.
Wow. Thank you. Great knowledge there. So you answered, you both killed it. Thank you for that, the knowledge that you've shared. I just want to also look at some of the comments and questions. This is Innocent and Chan. Thank you. He said, very informative. Can you have this broadcast? Yes, we're going to rebroadcast via YouTube and also Facebook. So yes. After this live, we will be sharing, just keep sharing the video, let more people get this information. We have Sister Sabina Jules. It will be nice for our doctors and pharmacists to come up with another video that can go viral and get home to Africa, explaining what you all just told us here. So thank you for that comment. I think we will be sharing this video, and we are the only ones that can make it go viral. So if you get it, share it, because the information is so powerful by our very own. And this is why I wanted us to just listen to our own scientists, our own doctors, pharmacists, healthcare workers, because our voices matter. Maybe we can convince some of our people who are hesitant when they hear their own, talking about it. So these ladies are very powerful, very intelligent, and very savvy. And we really appreciate that they are sharing the knowledge that they have with the community. So let me see, we have lots of comments. We'll take maybe a couple more questions. We have Pastor Adele Chengo. She said, do you still need to get the vaccine if you have developed immunity? So Dr. Santo, can you take this one?
Yes, and I think I answered that earlier, kind of on that.
Yes.
But yes, you do. One, because at least that's the, we do learn every day. So, but as of now, yes, because the those who have immunity, after taking the vaccine, develop even a more robust immunity. And given that we do have variants now in the community, you do not know how protective you will be if you do not take the vaccine. And then also, we're still trying to study how long the immunity is going to last. So as of now, yes, the answer is yes. But with time, as we gain more knowledge with the virus, maybe things will change. For now, for those reasons, yes.
Wow. Thank you. One last comment from Yvonne Onana. Hi, Yvonne. She says, well explained. And thank you, Doc. So the community definitely appreciates you guys for having this conversation. So I know that your time is very valuable. You're very busy. Gwen, for example, was working, had a busy day today, and so she had to rush home and get on this conversation. So Dr. Santo, we thank you. I know this is your 1 week break from work. I know you work very hard, and it's always an honor and a pleasure to have very powerful, dynamic, phenomenal women like yourselves sharing knowledge with our community and helping us to combat COVID-19. So I thank you very much. And we are going to actually continue these conversations with our healthcare workers, our community leaders, because we have to hear it. We have to get the right information. We have to empower each other. And, we don't want to lose any more lives to COVID-19. And we want to get back to some sense of normalcy. And the only way is to take advantage of the preventive methods and stuff that they have. The vaccine is one of them. Continue to mask up. Me personally, I can't wait to get my second dose and be able to give hugs to someone who has had, the vaccine as well. So, we've not been hugging each other for a very long time. And we're all looking forward to the best, the best to come. So thank you, ladies. Just one last word before we go. One last word of encouragement to our community. Yeah, Dr. Santo.
All right. So I believe in the vaccines. I'm a pro-vaccine. I respect everybody's choices. We have to think not only about ourselves, but about our community. And I believe in the vaccines so much that not only did I take the vaccines, my twin daughters, who are 19, soon to be 20 years old, also took the vaccine. And so I will encourage our community, while you're masking, washing your hands, social distancing, to consider making this wise decision for yourself and your community. Black people are actually more affected by this. And even if you do not die or you have just mild symptoms, you may develop what we call long hauler syndrome, with a lot of effects from the infection itself, and we don't know for how long. So the vaccine is safe. The vaccine can prolong lives. The vaccine can prevent unnecessary death. And we all need to do our part and also be part of the community and be each other's keeper and take care of ourselves and our family members and the most vulnerable ones. Thank you.
Thank you. Thank you, Doc. And Gwen, thank you.
I want to end this by saying help is here. Let's take advantage of it. So if you have any more questions about how you can get vaccines, you can reach me. Like I said, you can go to findashot.org, or if you're in Maryland, covidlink.maryland.org, and get your vaccines. You can actually inbox me if you have any more questions. If you want to find out how you can get the vaccine and you're not sure, I can help within the state of Maryland. But I can also point you maybe in your state where you can go to get the vaccine. I do believe in the vaccine too. We grew up with the vaccines. I still have my scars from vaccines from back home, So it's not a new phenomenon. We've been using vaccines to help diseases, and this is not the first time. We can see how this disease has killed so many people in our community and worldwide. Life virtually came to a standstill. And like in medicine and healthcare, we always say that if the benefit outweighs the risk, then we have to do it. And I think that the benefit of the vaccines does outweigh the risk in this case. So please, please, please get your vaccine. Let's stop those variants. Let's get that herd immunity so we can stop the deaths. We can get back to normal. Our kids can go back to school. They can do sports. In my case, my pride and joy wants to do sports. He hasn't played football for over a year and he would like to go back. So please, if you reach out to me, if you have any more questions, get your vaccines. They're safe. We had it, we're here, and it's going to be a long haul. So let's start arming right now.
Wow. Thank you, ladies. Y'all are phenomenal. We've had such a great conversation. And just to finish off with what Yvonne Onana just said, she got the vaccine. And let me highlight her comment. She also made a good point. I got mine and I made sure all my bubble got vaccinated. So your bubble is your family, your friends, the people that you hang out with, your coworkers. Talk to one another, talk to each other, encourage them to get their vaccines. So with everything said and done, it's been an amazing cocktails and conversation tonight. Thank you, ladies, and hopefully we'll touch base again soon. Thank you. God bless. Thank you.
Thank you for
And
having us.
thank you all for watching. Hope you join our conversations. The next one's coming up next weekend. Thank you so much. Okay, and yes, to all our powerful ladies out there. Oh, yes. Thank you and goodbye.